Hello and welcome to your Back to Fitness education session. This is session number 3, delivered to you from Southport and Ormskirk Hospital and the Joint Health Department there. So today we're going to concentrate on techniques to successfully manage your pain and again continue to myth bust a few things and touch on some different areas of management that we've not already seen. So first off, how can we successfully manage our pain? And the truth is that we can't over-rest it. Instead, we need to turn down that sensitivity that we were talking about in the last session. And if you can't remember, just skip back to the last quarter of session 2. We need to redefine that fuzzy section of the brain. Now, remember we said that we're neuroplastic and we can change, but we need to stimulate that change. We need to lubricate the joints within the lumbar vertebrae or within any joint in the body and stretch out those joint capsules so they don't get too stiff and maintain some level of movement and some level of fitness. So the important part there is not to think about the back as over-resting it, because if you do too much of that, you're not going to be protecting it at all. You're just going to be turning up the sensitivity, as we've already touched on. Surgical intervention is and always should be the last option, unless you have rapidly progressing neurological symptoms that we would be picking up as part of your assessment anyway, and you wouldn't be in this class or hopefully listen to this video if that was you. Surgery comes with its own set of risks. It's an invasive treatment, of course, and that comes with infection risks, and the success of that operation is also not guaranteed. And many people have ongoing pain after lumbar surgery. Things like failed back surgery syndrome, where they get persistent pain in the exact area where the surgery was and don't have any successful effect afterwards. Now, of course, there will be some success stories, but you don't very often see lumbar fusions occurring nowadays, and there's a reason for that, because the success of them was very limited. And we know from the evidence that we've been looking at over the past decade or so that exercise intervention and education alongside that is a better way to treat your back than somebody going in and trying to fix a structure that may or not be the problem in the first place. So if you remember back to some of the previous sessions when we're talking about diagnoses of lower back pain, well, sometimes if we can't be too specific about the structure that's causing that pain, and then somebody can go in and surgically intervene, fix that structure, and if it wasn't what was causing the problem in the first place, then you've gone in for an invasive, risky back surgery, and it's not solved the problem for you. So we don't very often see back surgeries today. In terms of medications, this always seems to be an area for debate with the patients that we see in the Back to Fitness sessions. And there's different categories of medications that may or may not help your specific problem. So muscle relaxants, anti-inflammatories, neuropathic medications and basic analgesics can all be used to try and relieve symptoms, and they can reduce symptoms. They're normally quite successful in reducing symptoms. Often, however, they don't treat the underlying drivers of that pain cycle, so they don't actually treat the cause or the reason behind your pain. But we do encourage taking pain relief in general. The idea behind it is that if you can take some sort of relief that will then enable you to complete some normal movement patterns, able you to walk for a period of time without pain, discomfort, or altering your walking pattern to avoid your pain, and generally being a little bit more relaxed, is all positive things in decreasing the sensitivity of that pain pathway and hopefully getting on the track to less pain in your back. What I would say is that a lot of patients say that they don't like to take medications regularly, they don't like to pop pills, they don't like to rely on medications, and that's all okay. But if this can help in the short term to get you moving a little bit more what you would consider normal for yourself, then the medications aren't a long-term intervention. The idea of them is that they can give you a sense of relief to then complete things that we know are going to help, and then you can wean that medication down after you've started moving a little bit more fluidly accordingly to that plan. So I think you've had your fair share of pain education, so you should be more than on your way. And the reason that we do it is that the evidence shows us pain education alongside exercise and alongside being in that environment of having a trustworthy source like your physiotherapist with you, it's been shown to increase your physical capacity and increase your quality of life. And that can only happen if our patients are being educated appropriately alongside doing the right form of exercise. And there's some studies that even show pain educations have better outcomes than core stability exercises in isolation. So we're moving with the evidence as we go through, and I think maybe 10 or 15 years ago this wouldn't be part of your treatment for lower back pain. It would probably be more hands-on therapy and the potential for surgical intervention should your conservative management or your physiotherapy not have worked. But we're changing that approach a little bit, really, and we do like to approach things with a bit of caution with our patients, especially with backs, because everybody knows somebody with a sore back and everybody has an idea of somebody that may have slipped their disc, and there's lots of worrying and concerning language used around lower back pain. So don't get hung up on structures. Don't think about specific bones, discs or ligaments in your back, because the most up-to-date research that we follow shows knowing more about the pain leads to better results than knowing more about your anatomy. So you could spend as long as you like looking at vertebral anatomy in the lumbar spine, but it wouldn't help your painful problem any more than up-to-date education around what's causing that pain would. So you should know anatomy is not only one part of the story, it's a bigger picture than that. So in terms of pain management strategies, it's important to recognise other things that may help our individual patients, bearing in mind that we put lots of emphasis on how different every patient is. So we need to open our minds up to other avenues of treatments or strategies to help with your pain. And here's just a quick list of things that we know has worked in certain patient groups and we know that works in general for chronic pain issues. So using diaphragmatic breathing or relaxation techniques can be a really useful way to reduce your pain. Maybe you can find yourself a comfortable position for your back. It could be lying down on your back with a pillow support. It could be it could be sat directly upwards in the armchair. The point is that once you find a comfortable position or your most comfortable position, you should try some relaxation techniques once in that position to try and forget about that pain. Try and distract yourself away from it. Heat and ice is always an interesting debate, and the evidence is very mixed and probably not conclusive enough to give absolute recommendations, but my advice would probably be just to try a period of heat and try a period of ice. 20 minutes application of both and see if that can relieve your pain, if at all. And the other thing that we definitely use is mindfulness, and there's an application called Smiling Minds, and that's a really good application that goes through lots of relaxation and mindfulness techniques and should hopefully give you, again, a little bit more distraction away from that problem, but can also help you feel like you're in control of your pain a little bit more. So please give a couple of those a go. It might be a case of trial and error for you, but give it a go. This animation of the disuse cycle is something that I use very regularly with my patients. So I think it's a nice way to kind of compartmentalise the process of the pain cycle and hopefully make it a little bit more digestible for the patients. So if we start up at the top right hand corner at pain, this is normally the first response that a patient will get. I've got a painful back, my back's gone, I've tried to pick something up and it feels like it's gone, I've woken up and I'm in pain. And the first thing we do as human beings when we're in pain is protect that pain, guard it. We don't want to be in more pain, so we tend to stop moving it, or we tend to guard it for a period of time. And if it's happened before, then we're likely to guard it for longer. Then what happens on I suppose more of a physiological level is you can get some local muscle spasm and some local inflammation following that. And that can then cause some restriction in mobility or some capsular tightness, some muscle tightness. Once that happens, we know that we're at risk of muscle weakness. So if a structure is tight and not moving and not being used correctly or used fluidly, the muscles are likely to get weak, and we know muscles can decondition very quickly. We then experience a loss of function. We can't do what we were doing a week ago. I've been in pain, I've rested, and now I feel like I can't push the hoover around like I could last week, and that can then lead to some anger, frustration and helplessness. It can lead to these things because the back can start to get in the way of normal daily function, spending time with family, etc., and it really becomes bigger or larger than life. You then experience more physical pain, but we don't necessarily take awareness of the muscle spasm, restricted mobility, muscle weakness and loss of normal function. The main things that you guys feel is the pain and the frustration. And it's important to realise that we can change this cycle. Rather than guarding for long periods of time, we can guard for shorter periods and use relative rest, and then try to integrate activities that we've sent to you, even when we know we're in a little bit of pain or discomfort. If we know that we're not going to make our back pain worse by trying some light exercise, then the relative rest theory is a lot easier to use. If we can keep moving a little bit more fluidly throughout that pain and guarding phase, you won't get as much muscle spasm or restricted mobility. The muscles won't get as weak, and then you won't lose as much function. Then if you can continue this and be consistent, it'll bring your pain down. So it's a really nice way just to contextualize that pain cycle for you. And of course, one of the main things that we want to have a look at is exercise. But the benefits of exercise, sometimes we don't quite pay much attention to, or perhaps we ignore it on purpose. At first, it should be enjoyment, and not all exercise is enjoyable for everybody, but any activity that your heart is pumping faster and we're getting our muscles to work and feel like they're working is a good exercise or a good activity. It also reassures the brain that the movement is okay and desensitizes that nervous system like we've been talking about. But we have to do that for a period of time. We have to be consistent for that to be the case. It boosts happy hormones. Dopamine gets released into our bloodstream after exercise. It can be a social outing. We know the benefits for our general cardiovascular fitness. It can improve quality of sleep, reduce anxiety and depression, increase bone density, help manage your weight, and in general helps us live longer. Now, of course, I've been trained to give you the spiel on why exercise is successful for our health, but in this particular case, I'm concentrating on why it's so helpful for your back, especially when you're in a sensitized area of pain. And if we then just have a brief look at some of our guidelines. So these physical activity guidelines have been updated in 2019 by a really great team, and they've done lots of research into muscle retention and especially aging muscles and how we can combat that weakening or that deconditioning process as we get older. And building strength has become a lot more important within this cycle. As you can see, it's in the middle of the poster there. So at least 2 days a week, we should be doing some sort of resistance training to keep muscles, bones and joints strong. This could be a form of gym work. This could be a form of physical labour. It could be a form of yoga. It's using resistance to test our muscles. And we should be doing that at least twice a week. So the class that we've sent over to you guys, you should and need to be doing that at least twice a week. And then outside of that, meeting these other guidelines. So being active, at least 150 minutes of moderate intensity a week, minimizing sedentary period, improving your balance or practicing balance-like activities for 2 days a week, and the benefits of which are at the top of that poster. So please pay attention to the purple highlighted text at the top. But in terms of examples of exercise, it doesn't always have to be exercise, it's just activity. Light activity can be doing the dishes, taking the rubbish out. Moderate activity could be walking, cycling, shopping, mowing the lawn, getting out into the garden, rearranging your garage, etc. It doesn't have to be formal exercise. And then, of course, vigorous and very vigorous activity are likely to be more competitive sports, sports or activities where we're putting a lot more strain upon the body. Sprints, heavy weight exercises, press-ups, swimming, etc. If you've been a swimmer in the past and you haven't swum in a while because of your back, why not give it a go? Start with something really light and start with only a length or two and just see how we get on and how we feel. So what exercise is good for us? And the truth is, any exercise is good for us, but we need to make sure that we're doing it in the right progressive way so we don't flare up our problems. But in short, we need to stretch and move for flexibility and maintain movement for flexibility. getting out of breath for general cardiovascular fitness, resistance training to strengthen muscles and support joints, and then balance and coordination training to improve your walking movement and your balance as we start to get a little bit older. And all those things, as I said, were on the physical activity for older adults guideline, and you can Google that. That's from NHS England as well. So how do I start? Well, this sometimes is the most challenging part. If you're not somebody that's done exercise or activity for a long time, be it because your lower back pain was stopping you from doing it or because life, etc., gets in the way, then it's important that we need to start nice and small and build your way back up. But initially, it'll be hard work. And initially, it'll be hard work to be consistent. But for the most benefit, you're looking to exercise for 30 minutes, 5 times a week, and looking to accumulate around 2.5 hours. And at least within that, you should do 2 circuit sessions or 2 circuit training sessions on the Back to Fitness exercise class that's been sent out to you. So as we touched on briefly, the consistency of your exercise interventions are really important, and making sure that you stick to the guidance that we've given you, despite differing levels of motivation, different levels of pain, etc. The boom and bust cycle is a good way to explain why we need to do that and why we need to pace ourselves at the start, and then build our way up. So the good days at the peak and the bad days at the trough of that graph. And if we start on a really high day, the likelihood is that the day after we're going to be feeling a little bit achy. The muscles are going to be stiff and we're going to do a lot less. And then the next time we do have a good day, we might not do as much as we did the first time because we felt like we were really paying for it the day after. And as you can see, if that process continues, the good days become slightly less active, and the bad days remain the same. And then overall, you get this trend of decreasing activity. And we want to try and reverse that trend and make an upwards graph with activity. So we'll start with smaller amounts of activity that we can manage over a longer period of time, and then gently try and build that up. We can do that by increasing the weight that we're doing, progressing the exercises on your program, or going for the advanced program, which is always an option, or prolonging activity for longer periods of time. There's lots of ways that you can test yourself, but the important part is that you start with something you know you can manage, be consistent with it, and then start to build it up once you feel like you can. And that's really where the pacing comes in as well. So making sure that using pacing as a strategy to reduce that boom and bust cycle, so aid that reverse deconditioning rather than it gently becoming less active over time or becoming more active. And it can also be helpful in achieving your goals. So if you want to be able to walk 2 miles without pain, then week 1 you're not going to start with 2 miles. We're going to start with 400 meters for 5 days in week 1, and then the next week we might go to 600, then the week after that we might go to 1 kilometre, etc. But that can be used to compartmentalise any activity: housework, gardening, exercise, etc. And finally, we're looking at coping with those bad days. So we know that not every day is going to be pain-free, and it's going to take effort and time to reverse that process with consistency, but also trying to look at things from a positive outlook. And those bad days are more often than not the opposite of that. It's important to realise that the flare-ups are normal. It's never a consistent trend of improvement. There's always setbacks and knockbacks, and flare-ups are always going to be part of that. But when you have a flare-up, try to remember back to what helped settle your pain. Did I try relaxation last time and it worked quite nicely? Was it distraction? Was it heat that I tried for a while that worked quite nicely for me? And then always remember that the relative rest from the aggravating activities is important, but not remaining active in some aspect is just as important, if not more important. Part of the exercise program we give you, there'll be exercises within that you find easier than others, and perhaps when you on a particularly bad day, we'll just try a couple of those easier exercises that'll put less strain through your back and cause less discomfort. But it's important that you keep moving it and remind yourself that even when we're on a bad day, we can still use and move our back. We're not going to damage it and make it worse. Gradually return to your normal activities after that and build your way back up to where you were. Now, it can feel like setbacks all the time, and that can lead into your frustration, but try and maintain a positive outlook. And if you have any questions around what specific exercises could be good when you have those flare-ups, or any questions outside of that, then please just get back in touch with your physiotherapist from our department and we'll help you out. Thank you for listening.